What's up, everyone? So, I just turned 25 and I got diagnosed with autism. Had no idea I had autism. I think I have a pretty crazy story, and I want to share a pretty dark side to autism that um, I haven't really seen on YouTube, at least. And maybe if there's people out there struggling with what I've been through, I'm sure there's other people that have. So hopefully this can help, or maybe you relate to this. Um, so yeah. So basically, I'm 25 years old, and on my birthday, I got diagnosed with autism. So happy birthday! You're autistic. That's what happened to me. I got diagnosed with autism on my birthday. Um, But honestly, it's a big blessing in disguise. I'm very thankful because what my life was like prior was absolute hell. So I'm going to be explaining what that was like. Um, and it's a lot of physical symptoms and doctor visits. Um, I think the impact that autism has had on me is very physical, a lot of medical stuff. So yeah, let's just get straight into it. So I have some notes. So what's the problem, right? My whole life, I've dealt with just physical issues in my body. When I was young, I had nerve pain in like my pelvis, didn't know what it was. Then I started peeing a bunch, like a lot. So those are two issues now. Then I started having just a bunch of food sensitivity, like the amount of foods I could eat really shrunk. Um, and then the way the foods would react in my body was very sensitive. I would poop a lot or I wouldn't poop at all. So IBS, irritable bowel syndrome, and the IBS would affect the other two symptoms. So let me slow down for you real quick. I had really bad nerve pain in my pelvis that would flare up, and I would pee all the time, um, every 15 minutes, and it was very intense and painful. And then the irritable bowel syndrome symptoms would impact the intensity and flare-ups of this. So they all were causing issues. And this was throughout my life from age 10 all the way up to now I'm 25. These issues are stacking. More recently, this is what led to my autism diagnosis. I started dealing with really bad rib pain. I have a rib that for the past 3 years has been feeling like it's digging in my sternum, and it hurts. It's very bad. So when you combine that pain, the rib pain, it hurts to turn my head. My range of motion is all messed up. I use my arms. Everything I do, I'm constantly reminded that my rib's in pain. And I've gone to doctors. I've gotten x-rays. I've done MRIs. I've seen chiropractors. I've seen like spine specialists. Um, they all have no idea what's going on. My spine looks perfectly fine. They have no explanation for the rib pain. Um, and that was very frustrating. And so you can imagine someone has all these physical symptoms. They have rib pain that's constant, plus all this other stuff, the nerve pain in the pelvis with the food sensitivity. My diet is very small and it's so sensitive. Um, eating out at restaurants is not very possible because they always use oils, and that week I can't do oils because my stomach's so sensitive. I ended up pooping out all the food, or food has to be cooked a certain way. Certain textures of food don't digest well for me. Um, Certain types of foods I can do one week and then I can't do the next. So eating is very problematic for my stomach, but it wasn't always like this. This was more recent, and then I got the rib pain. On top of that, I pee all the time, every 15 minutes. It disrupts my life. And there's a lot of anxiety around, is there going to be a bathroom? can I go to a place with no bathroom? How long do I have to be there? Do I go to a social gathering if there's no bathroom? Or there's a lot of anxiety around. It's kind of weird because the peeing sensation in my body is very intense. It's not just like I have to pee every 15 minutes. The sensitivity is like extreme. It's painful if I don't pee, and I have to pee often. So I pee all the time, but not only that, occasionally I can get these flare-ups with the nerves down there, and that can set me out of commission. That is so painful. Anyway, that nerve pain. Why am I saying all this? Well, there's no explanation for any of this. MRIs came back perfect. Blood tests came back perfect. X-rays came back perfect. And just overall, every exam I did. So, what does this have to do with autism? Well, what's very fascinating is my body's on fire, but the medical system says I'm perfectly fine. But am I perfectly fine if I'm peeing every 15 minutes? Am I perfectly fine if every time I engage my abs, there's a very high chance I get a nerve flare-up? That's one of the causes of the nerve flare-up is engaging my abs. Am I really perfectly fine if I can't use my arms and shoulders? And what really sucks about all of this is I used to work a physical job. I used to be a plumber. And that nerve pain got in the way of my job. And I decided to, for a lot of reasons, but one of the reasons I changed career paths, I decided to go to college, was because I was limiting my life because of this nerve pain, combined with all these other issues that stacked later on. But while I was in college, everything just got 10 times worse. So I'm in an environment that's less physical, but my body is more on fire. So I ended up, out of anger, after the rib pain, no answers, 24/7 pain, I ended up breaking my knuckles out of frustration multiple times, 2 times. So that wasn't pleasant, but something I learned from that is both times I broke my knuckles, the pain of the broken knuckle was not really that much compared to what was going on in my body. I remember when I broke my knuckle the first time, day one, I was like, wow, like that was something. But after like day two, I wasn't really even thinking about the knuckle. I was focused on my rib, the chronic pain in my rib that hurt. I was focused on managing my IBS that was so painful, and the gas that gets involved, the farting, right? The peeing every 15 minutes, the pain. I wasn't focused on my knuckle. And that really highlighted, holy crap, the pain in my body is worse than a broken bone. Now, it's a small bone. I broke my pinky twice, the same one. But, so it's a small bone, right? But it kind of disturbed me. Why is my body constantly in different regions having more intense pain than a broken bone? Like, that's like psychotic to be dealing with that all the time. But that's what I was dealing with. I was like, holy crap. Long story short, after that, I ended up getting some medical help, and they found out that I have autism. And I think that's when everything clicked, because a lot of my social life made a lot of sense with the struggles that autistic people have. So after the autism diagnosis, we started lining up that diagnosis with my life and my history, and they perfectly match. And what's interesting is that the conclusion we've come to is that I am simply, after 25 years of not knowing I'm autistic, my body is screaming that my nervous system's on fire. So we kind of recognize that all of this is just nervous system related. My body's holding tension. My body has probably weird and very tense posture, and it affects my stomach, it affects my rib, it affects my pelvic floor, the nerve pain. And so I get all these flare-ups, and there's nothing medically wrong with me. I'm simply just wired neurologically different. My brain is wired outside the range of normal. And so that was interesting for me to hear because that removed a lot of fear and anxiety related to these issues. I realized, holy crap, nothing's wrong with me. My body's just trying to communicate something to me. So that really helped shift a lot of the fear in my body. So that autism diagnosis really kind of saved my life because I was not in a good spot. I mean, why would you continue life if your body's on fire and you can't work, you're not in school, you can't even get out of bed, you're depressed, anxious, scared, in pain, doctors don't know what's going on, like why, what are you here for, and that's very hard. And, but after that autism diagnosis, I was like, holy crap, I just, I'm not hopeless anymore. There's a framework within autism that I can learn about and apply it to my life, and let's see what happens to my nervous system. And sure enough, I've been going to autistic therapy, learning a lot about kind of like things I might struggle with related to autism. Just I notice patterns and textures, they can really upset me. I didn't really know that. And I know as a kid that used to upset me, but as an adult, I don't think anything of it. But I think because I never think anything of it, my body has to. And I think that there's a lot of other autistic triggers that I never knew about, that I don't care about. But because I didn't care about it, my body has to. And so just learning about that was like, holy crap. And I'm seeing a lot of relief in doing the autistic therapy, learning how the mind-body connection, it can be pretty extreme combined with autism. That's a crazy combination, right? And I noticed that as was very fascinating to me is as I'm seeing the volume turned down on the rib pain and the peeing urgency is less. I pee now every 50 minutes. My poops are a lot better. I've been doing a lot of therapy and I'm in a better headspace, and it really affects my nervous system. And I'm noticing that all these issues that I would break my knuckles over, as the volume gets turned down, I'm noticing that my awareness is less internally focused on panicking what's going on in my body. My mind is always so preoccupied on the physical pain in my body, hyper fixated on it, that as this volume gets turned down, I'm noticing so many triggers in the outside world. I'm noticing sounds really affect me in a much larger way than I had thought. That's the biggest one that I've noticed. Textures as well. I've noticed textures on my clothing can sometimes put me in a bad mood. But yeah, sounds is a big one. I always listen to my music at a really loud volume. And after this diagnosis and realizing the mind-body connection combined with autistic triggers, I started listening to music at a much lower volume, and my digestion got way better. My heart rate has gone down. My heart rate was really high. I had really high blood pressure. And just combined with all the stress, trying to troubleshoot all this. But I'm constantly listening to music, and I usually always had the volume very loud, and I'm always it's very stimulating. And I didn't realize that if you're someone who's autistic and you're listening to loud music, loud sounds all the time, I don't know if that's always good, depending on, where you are within the range of symptoms for autism, right? And I learned very quickly that, wow, when I listen to music at a quieter volume, the volume of symptoms in my body is better. So I'm like, holy crap. So it's just, in a weird way, because I never knew how to process the world around me, my body just started to shut down. And so I've seen people on YouTube describe autistic shutdowns, but I haven't really seen them explain what that is, what that looks like. And I'm sure it's different for everyone. Um, but I think for me specifically, and the way that my brain is wired, and whatever slice of autism I have, um, that's my body shutting down. Is my stomach stops digesting, the foods I eat gets more strict, I get nerve pain in my pelvis, muscles tense up, and my posture over time changes to a point where nerves are being pushed on, and it works its way up to my rib, you know? And so I have this chronic pressure in these different spots in my body that don't go away. But I'm finding they're getting a lot better as I do autistic therapy and a lot of mindfulness related stuff to autism. I used to do a lot of mindfulness stuff. It didn't really help, but mindfulness stuff through the lens of autism, kind of an autism catered mindfulness, has been very helpful. So, yeah, I'm just sharing my journey. And one more thing I want to mention, I don't know if this should be another video, but I think this will be very fascinating to y'all. They said when I got my diagnosis that I was a high functioning autistic person, or whatever the diagnosis was. They said I was high functioning, and that really upset me. First of all, this was new to me. I had to ask what that meant, and they said I was high functioning, and that pissed me off because I'm peeing every 15 minutes. I'm not able to eat 90% of foods. I poop too much, or I poop too little, and then if I get constipated, it messes with how often I pee, and on top of that, I get nerve pain that I had to quit a career for that was physical, and I can't work out anymore because when I engage my abs, it triggers and pulls on that nerve. And then living a life like that, all of a sudden I'm getting chronic rib pain. So I had to drop out of college because I can't focus on anything, and my movement's limited here and in the abdomen. Am I really high functioning if I can't work a job? Am I really high functioning if I have to pee every 15 minutes and I can't go anywhere if there's no bathroom? Am I really high functioning if I can't eat at most restaurants or even food shop for premium items, right? Is that high functioning? I don't think so. I happen to be verbal. I can communicate. And to me, when I got that label, it just felt very dismissive of the fire inside my body. And guys, this is just the physical stuff in my body. This isn't even the mental load of it all. And I'm sure if you have autism, you understand all the mental stuff that comes with autism, right? My goodness. So I understand everyone has a different journey, but I really wanted to just describe that label of high functioning. I think is a completely useless label. It means nothing, because when someone with autism, I believe, has a nervous system that's completely fried, at least in my instance, I'm not even functioning. So that's just not even a thing. So that's just my story. This is also a huge blessing because I now have an answer for, I think, what's been going on in my body, and we'll see, but I'm seeing a lot of good progress. I still have all these issues, but I'm able to turn the volume down just a little bit more each month. It gets a little bit better. I think I'm having to undo 25 years of tension and a nervous system that's been on. I also lost a ton of hair. Some of it has grown back, which is pretty nice, but I had a photo of me. From like prior to my autism diagnosis, I lost a lot of hair. After the autism diagnosis, after autism therapy, a decent chunk of my hair has actually grown back, which is pretty nice. It's still pretty thin, but crazy shit, man. Autism will fuck you up. So that's my video. Just sharing the dark side of autism. There's a lot more to the story. If you suffer from any of these things, I'm going to have videos on it. I'm going to have videos related to pelvic floor stuff, irritable bowel syndrome, if you pee every 15 minutes, and just autism stuff in general, relatable content, but also tutorials, you know? I had little tricks that I would do going out to eat or using the bathroom. How do you live in those physical circumstances? So anyway, thanks for hearing my story. It means a lot. Best of luck.